Hello, I'm Jerry Marvel,
Hello, I'm Sang.
and in this digital story project, we will be explaining and building upon the first chapter, Public Services Online, of the book Digital Health by Barry Gunter. Public services available online are a convenient and fast alternative to the traditional method of visiting offices, hospitals, and other places in order to obtain information that we need. Services like renewing licenses, paying citations and bills, and reviewing your medical records are all available through various sources such as the internet, telephone, and interactive television. The cost of these technologies is also declining, which is another benefit of using them.
Good health is one of the most important part of one's life, and providing health-related information online will be very useful to the citizens. Also, according to the survey conducted by Pew Research Center's Internet and American Life Project, 1 in every 3 American adults have gone online to figure out a medical condition. Being able to provide this service to people easily anywhere gives them a boost in confidence while talking with doctors or nurses about their illness. Since the rise of internet in early 1990s, the world network population has grown from low millions to low billions. Even though many government institutions are resistant in providing all their services online, many are using ICTs to change the way public services are delivered as well as the ways in which citizens can interact with the government. IFC, the private arm of Bank Group, has financed US 1.5 billion and mobilizing another US $330 million for 84 ICT projects to date in 32 low-income countries. Separately, the World Bank has launched a US $40 million project called eGhana in 2006, improving Ghana's competitiveness in IT industries as well as support for enhancing public service delivery through e-government.
In January of 2010, U.S. Secretary of State Hillary Clinton outlined how the United States would promote internet freedom abroad. She emphasized several kinds of freedom, including the freedom to access information, such as the ability to use Wikipedia and Google inside Iran, the freedom of ordinary citizens to produce their own public media, such as the rights of Burmese activists to blog, and the freedom of citizens to converse with one another, such as the Chinese public's capacity to use instant messaging without interference.
The digital divide, a term originally coined by the National Telecommunication and Information Administration, is the gap between those who have access to and use digital technologies and those who do not. A recent survey done by British Broadcasting Corporation in 2010 finds that almost 4 in 5 people around the world believe that access to internet is a fundamental right.
In April 2012, the Pew Internet and American Life Project found that among a representative sample of Americans, 53% of those aged 65 and older, but only 34% of those aged 76 and older used the internet or email, in contrast to 97% of the 18 to 29 age group, 91% of the 30 to 49 age group, and 77% of the 50 to 64 age group. An estimated 15 million Americans, primarily in rural communities, don't even have access to entry-level broadband in their homes. In one project, the Colombian government has used kiosks in order to close the digital divide in their country. The kiosks have built-in computers for use by people without their own and act as a Wi-Fi hotspot for those who do. The program also encompasses specialized kiosks for virtual conference centers, connection to government offices, and to serving people with disabilities.
Recognizing the Internet's value for increasing literacy and decreasing poverty rates, the Colombian government launched its Vive Digital program to create a national digital ecosystem to extend Internet access throughout the Andean region. Vive Digital provides Internet access to Andean schools, business, and individuals through the public kiosk. A majority of Colombian population, more than 43 million people, live in Andean region.
In an effort to bridge the digital divide, £600,000 was earmarked by the British government to subsidize home computers for students at 50 schools across the country during 2008. Age, computer experience, and socioeconomic status also influence the digital divide. with the elderly and the poor having less access than the young and well off.
The Malaysian government has utilized kiosks in providing services to its citizens. One can now conduct transactions with government agencies such as Road Transport Department and private utility companies such as Telekom Malaysia Berhad with the help of kiosks installed around the streets. A growing number of visitors has helped the street kiosks to grow rapidly, especially as the government is promoting Malaysia as an international tourism destination.
Hospitals have utilized internet heavily in promoting patients' access to their information online. We asked a question regarding this topic to a healthcare professional on how internet has been used in her hospital to provide easy access to patient information. What do you see in the future of what the hospitals have available online for patients?
Well, Kelsey, which is where I work at, we right now already have the ability to where you don't have to come back for a follow-up appointment to look at your lab results, which is awesome because there was nothing worse than grandma going for her lab or going for lab work and then having to come back, pay another copay, wait in a waiting room just for test results. Now, literally, you can go get your test result, you get your test done. By the end of the day, you log into your online access. You have your lab results. You can view your X-rays, even upcoming appointments. So it's really a great form of communication. The doctors, I could send as a patient, I could send a message to the doctor. Can you please send my new prescription to the Kroger's over here? And they'll respond back to you. So these messages are going to the physicians and they're responding to them quickly, which is something that it almost reminds you of back in the day where it was like house calls. It almost reminds you of that because of their quick response. Used to, you got lucky if you talked to a nurse and the message actually got to the physician. So I'm seeing a lot of that. Also, in case of an emergency, it's really cool that you can say, okay, well, I'm having healthcare done in the system. They can access your stuff, and so they know what medications you're on, which is a big, huge issue that we have in medical. Is there's people that are on a ton of medications and you don't know what they're on. So and it's critical to know what people are taking, especially if they're on blood thinners and now they need surgery, things along those lines. So you're seeing a lot of physicians now carrying around iPads, and they can access all of your healthcare information. Also, consents and things like that are all done electronically now. There's not this big, huge paper trail. So I'm seeing a lot of that, which to me is making things more efficient. It's also causing care to be performed better because of the risks associated, especially like I said earlier with the blood thinners. I mean, heart medications, all that kind of stuff. It's just so nice to have everything right there at your fingertips.
Another method of delivery for public service is IDTV, which is mostly popular in UK compared to other countries, but internet usage has outpaced it today. During its peak popularity around 2004-2008, most popular IDTV content was local and community information, and it had the ability to perform several tasks including making appointments, submitting application, requesting information, making payments, and voting.
Online networks have vast potential and can be used for many purposes, including dramatic social change. For example, the Communist Party lost power in Moldova in 2009 when massive protests coordinated in part by text message, Facebook, and Twitter broke out after an obviously fraudulent election.
When applied to something less revolutionary like healthcare, however, online networks can help a patient become more actively involved in their treatment and also become more informed about their illness or condition. This can improve doctor-patient interaction and help patients make well-informed choices.
Online public forums for any kind of subject one may be interested in are flourishing on the internet today, and healthcare-related topics are not excluded. These forums may be made up of professionals in the healthcare industry, normal people looking for advice, or a combination of the two. Each forum has a different focus and different rules and regulations as to what may be discussed and in what way information must be presented. Some of these forums are moderated to ensure quality information is posted, while others are unregulated.
According According to Gunter, equitable rollout is the idea that providers of online public health services try to make these services available to as many people as possible, and that includes accounting for income, location, physical handicaps, language, and other factors. These concerns are much greater for public services than they are for private services because people expect adequate representation and inclusion in service offered by the people they elect. And elected officials want the service they offer to appeal to the largest amount of voters possible in order to keep their jobs.
Are there any new technologies that they're trying to roll out right now in the hospitals that aren't really implemented yet?
Not that I've been tuned in with. I know there's been some questioning about bedside delivery of pharmaceuticals, which would all be done e-scribed down to the pharmacy and then brought to the bedside, which actually is a good thought process. However, if you have a sedated patient, they legally can't sign for a narcotic medication and or sign for a bill. Also, narcotics now can't be e-scribed. They all have to be taken down to the pharmacy. So I see it as a good thing, like with antibiotics, especially if you really want to make sure that a patient goes home and takes the antibiotics. But the other side I see of that is the integration of healthcare, where like your insurance. To me, if you've come to my facility, we have your health insurance. I'd like to see my pharmacy have that information as well. Therefore, it's not a break in communication. And I'm seeing, we've all been in talks about this lately, especially with medication shortages. And I don't check email. So can you please give us some kind of, send me a text. Send the physicians a text, hey, we're out of Percocet today. So that they write for something different so people go home with medications. But as far as anything new, I really haven't seen the like I said earlier with the whole tracking system, that's the newest thing I've seen.
Okay. Other than what you just mentioned with the prescription thing, are there any negative effects you see with digital communication technology? Does it make anything more difficult?
Yes. Say your doctor, well, as far as like with the pharmacy, say your doctor prescribed you a medication to Kroger's over here. Kroger's doesn't have the medication. Well, can you send it to Walgreens? I can't. It was e-scribed to this facility only. That's a negative because there's not the, I guess basically there's not the ability to continue the care. Instead, it's like, oh, well, this was your only stopping point and this is it. Instead of being able to shoot a message to Walgreens or the pharmacy, call it in, they can't do that. The negative side to technology is that people have gotten so smart. The reason why you can't get Vicodin or anything like that e-scribed anymore is because people have learned how to hack into the system. Now, Tylenol codeine is the only thing that you can get e-scribed. Everything else now is triplicate form. So I'm seeing that as a huge negative because you have these patients that are going without proper pain management because of unfortunately people that are too involved in technology that have used it for no good versus good. As far as anything else negative, no.
In conclusion, the amount and quality of public services available online today is vastly improved from when digital health was published, and it is likely a field that will continue to grow, especially in the area of healthcare. We hope our presentation was both enjoyable and informative. Thank you for watching.